So we'll switch gears now, and I would like to provide an update on our vaccine rollout efforts here in Halton, including milestones reached to date and an overview of planning for phase 2. After my presentation, Jane will provide some additional details of how Halton Region is preparing for the vaccine rollout, including facilities planning and human resources work to secure staffing for our clinics. Next slide, please. So this slide shows our vaccine rollout progress to date. I'll highlight a few key milestones. On January the 23rd, all residents of long-term care homes in Halton had received an opportunity for their first dose of vaccine. On the 30th of January, all residents of high-risk retirement homes had received an opportunity for their first dose of the vaccine. On February the 9th, along with representatives from Peel Region, Simcoe-Muskoka District Health Unit, and Durham Region Health Units, Halton Region Public Health provided a presentation to General Rick Hillier on vaccine management preparedness. The purpose of this knowledge sharing session was to demonstrate readiness to respond to various vaccine management scenarios, to provide an opportunity from the health units to learn from one another, and to get more information from the province related to the various pieces of the implementation plan that they are responsible for. I will speak about these in a later slide. Our goal right now is to complete second dose vaccinations for all residents in long-term care and high-risk retirement homes by February the 21st. This will be followed by vaccination of staff and essential caregivers in these facilities, potentially by the end of the month, along with beginning the rest of the retirement homes and other seniors congregate settings. This is all contingent on vaccine supply. Next slide, please. So recently we added a vaccinations tab within our COVID-19 dashboard, which displays the number of doses administered in Halton to date, including doses administered by Halton Region mobile teams, as well as doses administered by Halton Healthcare at their site. The data will be refreshed once a week on Fridays. We will further expand upon this tab as the vaccine rollout continues and data reporting capabilities are expanded. Also, we have added information about the number of variants of concern cases on the case counts tab of the dashboard at halton.ca/COVID-19. The information appears in a sentence just below the total number of cases and the breakdown of these cases by status. Next slide, please. As shown on our dashboard, as of February the 11th, the Halton Healthcare Vaccination Centre at Oakville-Trafalgar Memorial Hospital had administered a total of 12,221 doses of COVID vaccine, while Halton Region Public Health and Paramedic mobile teams administered a further 6,493 doses in long-term care and high-risk retirement homes, for a total of 18,714 doses. Next slide, please. Halton's vaccine distribution plan is well underway and has been guided and directed by several documents. So we received guidance from the National Advisory Committee on Immunization and the province's 3-phase vaccination plan. Available guidance also comes from Ontario's COVID-19 Vaccine Distribution Task Force and the Provincial Ethical Framework for COVID-19. Most recently, the province released a healthcare worker prioritization document, which we are currently reviewing to understand how best to implement with our local partners. While these federal and provincial sources provide broad direction on vaccine administration and the identification of priority populations, Halton Region Public Health is also examining our local data to help us better understand who is most at risk for COVID-19 in Halton and plan our vaccination rollout accordingly. For example, knowing age groups and languages most frequently spoken by those at risk will help us ensure we are using this lens for our communication on the vaccine program. Next slide, please. So this slide is likely familiar to you from my last monthly update. It provides an overview of Halton's vaccine distribution plan, including number of individuals in each priority population. We've been updating this as we get more information from the province on definitions of populations to be prioritized. It's important to note that these are rough estimates of the number of individuals in each priority population, and there is likely significant overlap across the groups. A word of caution, these numbers do not add up to total Halton's population. Public health is continuing to actively work with our community partners and to consult scientific literature to gather data on the priority populations identified by the ministry in order to ensure we have good planning estimates for vaccine distribution this spring and summer. We anticipate that the province will be coming forward with additional definitions and guidance for some of these priority groups, and we will update and communicate our vaccination strategy accordingly. For instance, only high-risk healthcare workers will be immunized in phase 1, and others will be immunized in phase 2 when there is more vaccine supply. For now, our ability to immunize remains dependent on vaccine supply and clearer prioritization from the province. We've been informed that we may be able to begin immunizing older adults next month if supply is available. This means while we will begin phase 2, we will also continue to immunize those eligible from phase 1. Next slide, please. In addition to the work we are doing to identify priority populations for vaccination, we've also been busy preparing for our vaccination clinics for priority populations starting in March. To reach our priority populations, we are currently assessing a variety of clinic models. To date, 2 models have been used. Mobile clinics, such as the clinics used at long-term care and high-risk retirement homes, and fixed site clinics, such as the clinic at Halton Healthcare Hospital site. We will be expanding these types of clinics to also offer community immunization clinics for priority populations. Halton Region has been working with municipal partners and the private sector to select appropriate sites for these clinics. Clinic locations are being assessed based on several factors, some of which include health and safety measures, such as physical distancing requirements are being maintained while maximizing vaccine administration. Ensuring clinics are accessible, for example, that the locations are close to transit, ample parking is available, and persons with disabilities can safely access the site. Finally, clinic locations must have sufficient amenities, such as a secure space to store supplies and adequate storage requirements for the vaccine, as well as internet access. Another important consideration is clinic staffing. We have undergone planning to determine what our staffing requirements will be to operate 4 clinics across the region. We estimate that each clinic will require well over 100 staff, including immunizers and support staff. And Jane will come to that a little bit later. Next slide, please. So this slide is an example of the planning work that is underway. As you can see, each cohort of individuals being immunized will need 2 doses of vaccine. So we will need to double up capacity after 3 weeks of launching each clinic site to allow for this. Once all staff, supplies, and sites are in place, any transition to ramp up capacity would be best achieved over a 3-week period. This would allow us to train staff thoroughly and will align with the second dose schedule, as the increased capacity expected at the end of the 3 weeks can be used for new first doses, while still accommodating for the second doses that we are responsible for. Next slide, please. Throughout our vaccination rollout, providing accurate, up-to-date information to the public is critical. In phase 1, specific messages have been provided to priority populations, such as long-term care homes and healthcare workers, to support access to vaccination. For example, we ensured single consent forms for both doses were provided ahead of time to long-term care home directors of care with additional information on the vaccines, so that residents of long-term care, their family members and powers of attorney, along with long-term care staff, had enough time to make informed decisions. Since early January, Dr. Joanna Oda has been holding weekly meetings with our long-term care home and retirement home directors of care in order to provide them with the most up-to-date information and respond to their questions and concerns. During this phase, we've also enhanced local partnerships with municipalities and hospitals to ensure consistent messaging to the community. Tonight, Dr. Oda and I will be hosting our annual medical education event for all Halton physicians. The topic will be on how to address vaccine hesitancy, and we will then allow for an additional hour of question and answer session with our physicians, who are an important group in our communication strategy, as they are trusted by our residents to provide them with guidance and information. In phases 2 and 3, different strategies will be used in order to support the successful delivery and uptake of the vaccine. To inform the vaccination communication strategy, information about vaccine hesitancy has been gathered, and learnings from past public health mass vaccination clinics will be applied. We are working to understand the needs of vulnerable populations who may have barriers to accessing information, and will put supports in place to address such barriers. For example, as I already mentioned, we know what the top languages are spoken by certain priority populations, such as seniors and essential workers more likely to get COVID. And we will use this information to translate our materials. Throughout all phases, Halton.ca will provide the most recent information on vaccine rollout and eligibility. Next slide, please. An important part of planning the vaccine rollout is identifying risks and ways to mitigate those risks. We also report risks to the Ministry of Health as part of our quarterly reporting in public health. Over the next 2 slides, I've highlighted the risks that have been identified and our planned approach to mitigate them. A few of these risks have been submitted to the Ministry of Health as part of our quarterly reporting for 2020. Others were shared with General Hillier and Ministry staff at our knowledge sharing session. The greatest risk lies with vaccine supply and delivery. In the event that vaccine supply continues to be behind schedule and we have a shortage, or should vaccines be delivered ahead of schedule and we have excess supply, we will follow our local vaccine distribution plan, which accounts for both of these scenarios. Since December, we've already experienced several interruptions in vaccine supply, requiring us to adjust our plans and further prioritize who can receive the vaccine. If we receive an unexpectedly large supply of vaccines, a similar model used for the annual influenza vaccines would be used. In this scenario, public health would partner with local physicians and pharmacies to support increased distribution of vaccines to the public. Vaccine prioritization and allocation is another important risk to consider. While the province has identified priority populations within their 3-phased distribution plan, a number of these categories have yet to be well defined, and further guidance will be needed to ensure vaccines are distributed consistently across the province. For example, essential workers is a particular category that will require additional direction. To mitigate this risk, medical officers of health have advocated to the province to use a simple prioritization scheme to ensure that we do not end up spending more time on prioritizing people than vaccinating them. We anticipate that the province will be coming forward with more detail on this soon. In the meantime, Halton Region Public Health is continuing to actively work with community partners to identify the priority populations that have been identified by the ministry so that we are ready for our planning. Surge capacity is another risk to operations. Should there be a sudden demand for a non-COVID response, such as another disease outbreak or an emergency event, it would be challenging for staff to respond. In this scenario, public health would do our best to follow our business continuity plans. We would also rely on mutual aid agreements between other health units and seek support from the emergency management branch of the Ministry of Health. Another significant risk we face is inadequate staffing to operate vaccination clinics while continuing our current response to the pandemic. On an earlier slide, I shared that we would require well over 100 staff at each of the community clinic sites, with a total of 600 staff across the anticipated 4 locations. To ensure we have adequate staffing, we've already begun large-scale recruitment for immunizers and other clinic support staff, including supervisors. To ensure our workforce remains healthy, we will encourage staff to take vacation time and provide wellness supports. Redeployment of current staff in public health will be limited, given the possibility of a 3rd wave of the pandemic and our need to continue efforts with case and contact management, outbreak management, and limited other critical public health work. Next slide, please. Communications will be an important tool to encourage vaccine uptake and address hesitancy. There is a risk of different health units providing different vaccine messages to the public. To address this risk, we have asked the province to develop consistent and centralized messages that we can amplify locally. We will also implement targeted local campaigns to support vaccination. So COVAX will be the information management system in Ontario for immunizers across all vaccination settings to record and manage information on COVID immunization. It will also be used as the provincial appointment booking system across the province. Given the importance of this application, Halton Region Public Health staff will require training on the COVAX system. To mitigate the risk of a COVAX technology failure, we are developing parallel tools to track vaccine clinic data. The registration and booking system within COVAX are yet to be completed by the ministry. Halton Region Public Health hopes to be part of a pilot in the final week of February. As you can imagine, the timelines for the system to be fully functional are extremely tight, as we may be standing up a priority population clinic by early March. We will require increased supplies of PPE and IT equipment to support clinic operations. To mitigate the risk of having inadequate supplies, Halton Region Finance staff supporting vaccine operations will source additional PPE and IT supplies and arrange for storage. We are truly grateful to them because they have really been one step ahead of many in helping us acquire the needed equipment throughout this pandemic. A vaccine rollout of this scale will require substantial funding. We are hopeful that adequate funding will be provided at both the provincial and municipal levels to ensure the effective rollout of COVID-19 vaccines. And finally, there are multiple risks to reopening the province. Acquiring appropriate facilities for community clinics may be challenging, as they may now need to be used for other purposes. Reopening may lead to a worse third wave, which would mean we could have staff who fall sick and can't work, or staff refusing to work out of fear. This will reduce the speed of our vaccination efforts. To date, we have not done a thorough investigation of mitigation strategies for this. Next slide, please. While the COVID vaccine rollout is unprecedented, public health has a long history of administering significant vaccination programs. Vaccination is, after all, a core activity of public health. We will be drawing on our extensive experience with other large-scale vaccination clinics, such as H1N1, the hepatitis A vaccine clinic that we implemented at the end of 2019, and the current grade 7 clinics in community centers. Providing these grade 7 clinics during the pandemic has provided us an opportunity to learn how to manage large clinics with additional infection prevention and control measures in place. This experience will serve us well as we roll out COVID vaccine clinics. Next slide, please. So vaccination is an important tool in our fight against COVID-19. However, it is not yet time to reduce public health measures. The vaccine will help people fight the virus and make symptoms milder if they do get COVID-19. At this time, it's not known whether vaccinated individuals who become infected with the virus will be able to transmit the virus to others while asymptomatic. So even those who have received the vaccine must continue to follow public health measures until we have more information. As I noted earlier, as the economy is reopened, we can expect a third wave of the COVID-19 pandemic, potentially one that could spiral easily if, as modelers have predicted, the COVID variants are the more dominant strains over the next few months. Staying home, maintaining physical distancing, washing hands, and wearing a mask have been proven to reduce the overall spread of COVID-19. With our students back in school and our economy slowly beginning to reopen, we need to be diligent and continue to do our part to keep our community safe. And with that, I will now turn it over to CAO Jane McCaskill to provide some further information and wrap up today's COVID-19 update. Thank you so much.
Thanks very much, Hamida. Chair, members of council, I'm just going to provide, and given the time, if you can go to the next slide, please. I'm going to go fairly quickly. I was only going to give a brief update. Anyway, I just wanted to give council an overview of the preparations that are ongoing so that we are ready to open public health priority population clinics starting as early as early March, as Dr. McGaney has said, depending on the availability of vaccines. These These clinics would be in addition to the clinics at our hospitals and our mobile clinics, which will continue to operate using our paramedics and public health staff. But given the time, I'm going to be fairly brief. The work that has been ongoing by the vaccine committee is significant and is consuming a considerable amount of corporate resource, and that's why I want to make sure that you're up to date. As I said, staff is making the necessary arrangements to be able to open a priority clinic in each municipality in March. To support the clinics, and if you can just go to the next slide, it's the last slide. To support the clinics, over the past 2 to 3 weeks, we've posted over 500 jobs to work in the clinics, and already interviewed over 400 individuals, and that's required significant additional staffing in HR, weekend and evening interviews, etc. And we have 200 staff ready to start at the region next Monday and begin a very extensive orientation and training program to be clinic ready as required. That's definitely a record for us in terms of 200 staff starting all in one day. And we are actually on pace to have an additional 200 staff if we meet our recruiting goal the following week. So it'll be 400 staff within 2 weeks. So we're definitely ramped up to be ready to staff the clinic, and that includes immunizers as well as the many support staff that are required at each site, as Hamid indicated, depending on the size of the sites, and that will vary over the course of the vaccination period, depending on the availability of vaccine, et cetera. But we may need anywhere from 50 to 100 staff at a clinic, depending on the size and how it's operating. In addition to staff, supplies and equipment are also key requirements. And we have procured thousands of items getting ready for these clinics, and spent about $1 million to date on unplanned requirements that are required to support the clinics. And we've had to make arrangements for additional storage because, as you can imagine, we have a tremendous amount of materials that we need to store and then distribute to the clinics as they open and function. Another key requirement that we have had to work through have been related to IT. We have had a tremendous amount of IT support required, and that goes from anything to supporting the provincial COVAX ON system, which has to do with vaccination management, where all the vaccines are reported. We've been using that system and have it up and running for our mobile clinics, and we need to and have been updating our processes, et cetera, to be able to use the system effectively in the clinic environment. In addition, we are looking at the scheduling system and looking at how residents are going to be able to, or the priority populations in the short term, are going to be able to schedule their COVID vaccination. It was anticipated that there will be a scheduling system within the provincial COVAX system. However, there have been some delays in the delivery of that system, and that is likely going to require us to have our own approach and system to achieve the scheduling for our residents. So that's underway and will be a significant amount of work in the next week or so to address. We also have IT working on staff scheduling because we have, as I've said, a large number of staff who will need to be scheduled in these clinics that they plan to run 7 days a week and have varying shifts. So a staff scheduling system was key, an inventory system to look after the supplies we've talked about, and a vaccine distribution management system that will help facilitate once primary care is able to vaccinate It's anticipated that public health would have a role in distributing the vaccine to the primary care, and we need to have a system available and ready when the province makes the decision to go forward with that. And finally, just to note the demand for our communications, and Anita touched on this, and Access Halton has been significant throughout the pandemic, and we are expecting and planning for this demand to become even greater as we enter into the vaccination phase of the pandemic. There'll be a need, particularly in this next phase, for the vaccination clinics where we have priority populations, to clearly communicate who is eligible for vaccines and how they can get their vaccines. And there'll also be a need through Access Halton to be able to assist residents who are trying to book. So all of that work and planning is well underway. And again, my goal today was really just to give you some highlights. I've cut back what I was going to say, but I just sort of touched on the highlights. I just wanted to give council confidence that we are planning for these vaccination clinics. It's well underway, and we are preparing for what is expected, and what we hear in the media and what we hear in our meetings is that the supply of vaccine will increase, or should increase, over the next number of weeks and months. And we are working to be prepared to be able to respond to that and ensure that we get vaccines into arms in Halton. So I'll wrap it up there, Chair Carr, and both Dr. Magani and I are available for questions if there are any.